Hi everyone, my name's Elizabeth Davis. I'm the Director of COSI, Clinical Operations Strategy Implementation at Metro North, and I'm the MC for today. Not quite sure why I'm so lucky, but I'll try and do my best. So thank you everyone for being here today. Very happy to launch the yellow envelope and very excited to have the opportunity for us all to come together today for this launch. A year ago, Metro North, PHN and QAS and a number of NGO partners formed innovation alliances in preparation for winter last year, and I was the facilitator of the Primary Care to Emergency Innovation Alliance, and that the work of that group gave us an opportunity to reintroduce and reinvigorate the yellow envelope, which has been around for a while but needed some updating. So very, very happy to be here today as being involved in that group, and also very excited that we managed to do this work. Yellow envelope is a key tool for emergency and hospital staff needing the information they require to look after patients appropriately, and for clinical handover from aged care facility residents when they come into emergency department and into the hospital, and also has key information for when patients are discharged from hospital and back to the aged care facilities. We are launching the yellow envelope here today, but the plan is to roll it out across Metro North. And I've also got some interest from the statewide end of life team around seeing we can use it wider across Queensland, so that's really, really great. And also the timing of the launch of this works in very well with the Metro North and PHN Year of the Frail Older Person. So there's a lot of work that's going together on developing programs for frail older people, and very many of them are residents in aged care facilities. Anyone who knows me will know that we manage a telehealth service in COSI, so I couldn't have a speech without mentioning the telehealth service and how we'd really like to introduce the telehealth portal to aged care facilities for patients so that they can have outpatient appointments and avoid coming to hospital. And we've been working with the Redcliffe aged care facility service around doing that, so that's great as well. So I'd now like to invite Helen Hall, who's the PHN Manager of Primary and Community Care Coordination, to come and speak to us and play us the video.
I just want to share a little bit of history around the humble yellow envelope. Its story's long, but I'll keep it brief. So the origin of the yellow envelope really began back in 2002, when the General Practice Advisory Group held a multidisciplinary statewide forum with the aim of improving discharge to primary care across Queensland. The outcome was to form a framework, a practical set of directions for use by all service providers involved in continuity of care planning. In 2007, the continuity of care planning framework for Queensland came into effect. In 2007, an Australian Catholic University survey of residential aged care facilities found that 84% of respondents across Queensland experienced problems receiving information from hospitals and were really concerned about the continuity and safety of patient management. We also heard from the hospitals that patients were often admitted because they didn't really understand the reason they were sent to hospital in the first place. So communication from EDs was inconsistent, and discharge information from admissions was sent to GPs but not to the aged care centre. So they were running blind. So in 2007, the Moreton Bay Division of GPs started working across the hospital, GPs, residential aged care and the ambulance to work toward a solution. And this was the birth of the yellow envelope. So it started here at Redcliffe Hospital, and I was the project officer at the time. In July 2007, I was asked by the then GP partners, the Brisbane North Division of GPs, to roll this initiative out to Prince Charles and to Royal Brisbane, which we did. The envelope was then taken up by other centres such as Ipswich, Brisbane South, Townsville, Cairns and Mackay. In 2008-2009, the Australian Commission on Safety and Quality in Healthcare chose to focus their funding round on clinical handover. So we took that opportunity to develop an audit process and tools around admission and discharge information from residential aged care to the acute sector. We partnered with the Royal Brisbane and we undertook an audit on the residential aged care handover, which was very interesting. And this was about 18 months after the yellow envelope was first introduced. What we did was found that it was very hit and miss, the use of the envelope, and so we launched an intense education about the envelope program across the hospital and the residential aged care facilities. And in 3 months there was a marked improvement on communication. At the same time, another project was started with Queensland Health, and that was around the interim medication administration record. So it was more about the process of ensuring that the communication about medication was sent out to residential aged care at the same time. So the two processes combined really increased safety and communication between the acute sector and residential aged care. But organisations change, time change, and attention wasn't kept on the product. And so we need to relaunch, we need to revamp. Today, the launch of the refreshed yellow envelope also sees the IMAR being increased to an EDMAR. So the ED departments are looking at taking on board that process of ensuring medication management is improved in discharge processes. So the concept of the yellow envelope has been refreshed through the transition collaboratives, the winter alliances, and that work is really led by Emma Dalglish and her manager, Michelle Smith. The refresh of the envelope has also seen a combining of two tools that were invented, if you like, at the same time, with the funding from the Australian Commission on Safety and Quality in Healthcare, the SBAR. So that was developed in 2009. It's a communication tool used well throughout Queensland Health and is now prominent on the yellow envelope to further enhance that communication, the understanding of that communication between residential aged care and the acute sector. So in 10 years, we see the yellow envelope go full circle. I can't say that word. And it's very fitting that the launch of the refreshed envelope is once again here at Redcliffe Hospital. Well done.